Good afternoon. Mayor of Galway, Taoiseach, members of Governing Authority, public representatives, colleagues, partners and supporters. It gives me great pleasure to welcome you to the opening of the Lambe Institute for Translational Research and the HRB Clinical Research Facility today. I would like also to welcome staff from Taoiseach University Healthcare Group who could not be with us, but today they are attending by live streaming of this event. So today's opening represents the culmination of a project which was marked from its inception by partnership. This partnership brought together NUI Galway, Taoiseach University Healthcare Group, Health Research Board and the Galway University Foundation. And while it's risky to single out individuals when so many people were involved in the project, I would like to express particular gratitude to Bridget Howley, former General Manager of GUH, and Tony Carney, former Dean of the College of Medicine, Nursing and Health Sciences, who were hugely supportive of this venture from the beginning. The purpose of the project was to build clinical research infrastructure embedded in our healthcare delivery system. And while physically the location is on the grounds of Galway University Hospital, operationally it will also extend to other Taoiseach hospitals and onward to primary care and population health. We've emphasised the primary care and population health aspects of our programme with the goal of ensuring that research results span the bench, the bedside, community and onward to the population. Our goal is to make a difference to the lives of people afflicted with illness and to promote health and well-being in those who are not. This facility will enhance our abilities to function in a patient-centred manner. So as mentioned, our goal is to enhance the health of the people we serve. We would also, however, see the benefits extending globally beyond our shores through our international partnerships. Another goal of the project was to put in place an academic infrastructure which would enhance our ability to recruit and retain the best staff, and I'm sure this facility will enhance our ability to retain our brightest and best and to attract from overseas staff who will enhance our ability to deliver excellent health care. I'm confident that the investment marked by today's opening will lead to better patient care. We're all aware of the challenges which face our health service, but there's substantial evidence that when healthcare is delivered in an environment in which clinical research is conducted, that outcomes are improved. Finally, the building also represents a commitment to contribute to economic recovery, and engagement with SMEs and multinationals will continue to ensure that new treatments developed out of our basic research programs will reach patients in a timely manner. So I'd like now to call on Maurice Power, CEO of Taoiseach University Healthcare Group, to say a few words.
Thanks, Tim, for that. And on behalf of the Taoiseach and guests, on behalf of the Taoiseach University Healthcare Group, I'm delighted to welcome you here today to UHG site to mark the official opening of the Lambe Institute for Translational Research in the HRB Clinical Facility. This facility at the interface of research and clinical sciences will enable the development of new and innovative therapies and technology and allow their translation into direct patient care. This building and the research that is and will be undertaken here in the future is a true manifestation of our linkages with our academic partner NUIG Galway, and it underpins our hospital group's firm commitment to provide high-quality patient care that is based on excellence in clinical research, clinical practice and teaching. A development of this scale allows us as a hospital group, in partnership with NUIG, to attract and retain the highest calibre of medical professionals and researchers to the region. Galway has become a significant hub for the medical technology sector over the last 10 years, and we look forward to strengthening our existing relationship with this industry through the work that is undertaken in this facility. As you can appreciate as you look around you, a facility like this took many years of planning, development and sheer hard work by many people in the hospital, the wider HSC, the university and the HRB. In particular, I would like to pay tribute to the former UHG manager, Ms. Bridget Howley, who together with Professor Tim O'Brien and Professor Larry Egan, from the health services perspective, took this project from a concept to reality, and I congratulate them on that. I would also like to acknowledge the role our former CEO, Bill Mara, played in furthering this project. Working with the President, Dr. Jim Brown, he played an important role in ensuring that this was a strategic priority for the Sale University Healthcare Group. I also thank the philanthropic donors for their important support to this project, and of course, the financial support that we've got from the HRB. I would like to acknowledge the contribution of our colleagues in the HCC estates, who along with our own maintenance staff in the hospital provided the technical expertise while the construction was taking place in partnership with NUIG, and who were supported and assisted in all stages by the current hospital manager, Anne Cosgrove. Ultimately, our job in the health services is to provide the very best outcomes we can for our patients. Under the leadership of Professor Martin O'Donnell, this development brings new and innovative treatments, therapies and interventions to our patients' bedside. It enables the Celtic Group and NUIG Galway to be at the forefront of clinical research and ensures that Galway, and indeed the West of Ireland and the North West of Ireland, are recognised nationally and internationally as leaders in clinical research. On behalf of the Celtic Group, I congratulate all involved in this development and confirm the group's ongoing commitment to education and research. Thank you.
So I think it's very clear that this facility would not have happened without the support of the Health Research Board. And I'd like to ask Graham Love, the Chief Executive of the Health Research Board, to say a few words at this point. Thanks, Graham.
Taoiseach, President, distinguished guests, taxpayers of Ireland, and above all, patients. It's with great delight to be here today to see the opening of this facility. It's been a long road. I think it's testament to human perseverance and having a singular, clear vision about what science and translation of science can mean for the benefit of patients. It's fantastic we have this opportunity in this region and in this group. I think it's important with such a long journey, as my Director of Communications pointed out to me today. I'm the third HRB CEO since this building project started. So I can tell you it's with some relief that I'm here today to see things into success. This is part of a journey we're travelling nationally as well. We've put some 12 million into this facility, a further 7 or 8 million into Martin O'Donnell's group. But we've put approximately 100 million of taxpayers' money into the larger clinical research infrastructure. And Ireland is really beginning to catch up at this now with similar facilities and other groups, the building out of clinical trial networks and the establishment of a shared service centre connecting this to put Ireland properly on the map and effectively translate the type of research that happens in this university and hospital group to the benefit of the patients in this region, but also nationally for our country. We're delighted to be part of this. We see this as a natural evolution in our strategy and pushing Irish healthcare up the tables. And I'd like to congratulate a list too long to be named individually here today for getting us over the line. Back to that point about persevering and being clear about your vision and getting it over the line. From the point of view of the HRB as the main national funder of health research in the country, this is a seminal moment. We're very proud. I'd like to say thank you to all those past and present for getting us here, and I wish enormous and fantastic luck on all of you in delivering for patient care. Thank you very much.
Another person who's played an enormous role in this project from the very beginning, first as Registrar and subsequently as President of NUI Galway, is Dr. Jim Brown. And I'm going to ask Dr. Jim Brown to say a few words now and to introduce Taoiseach. Thank you.
Gormago Tim, a Vera na Galliva, a Hisi Usul, Builud Ras na Holskara, on the Fibli, Kolakaha, a Corjags Vinush to Galer. Falcherov Gujin Okad Sunsuk Shaw, Augustin Taoiseach, Egg Sholu, Augustin Oslu, Go Hefigul, and Frighten of Augustin Togra, Fear House Shaw, the Yurhurna Hearn. Good afternoon and welcome to this very fine occasion when we launch what is a tremendously important facility for our region, indeed for our country. It's my great pleasure to be here on what is another landmark day in the history of our university and of the Celtic Hospital Group. We mark the opening of a tremendously important facility, as Graham has indicated, a combination of translational and clinical research, which comprises the Lambe Institute for Translational Research and the HRB Clinical Research Facility. I'm glad so many people are here who support this project over its rather long gestation, I think, as Graham hinted a moment ago, and properly so. I also want to extend a welcome to those who are viewing us digitally, who are joining us on the web. This event has been live streamed to our academies in Galway, Letterkenny, Sligo, Castlebar, Taoiseach, Roscommon and Portiuncula, and also, in fact, around the world to some of our alumni who are watching it in the UK and in the wider world. I'm also very pleased that Taoiseach is here to mark what is another NUI Galway opening and now bringing to a close the end of our sort of 400 million capital development programme of the past 10 plus years. As I've said, it's a milestone day for the university and particularly for medicine and health science in the university. It marks the completion of an ecosystem which brings together medical education, biomedical scholarship, clinical research and healthcare practice in this region. Our College of Nursing, Medicine and Healthcare has a long and distinguished history. We are now closely working with the Enda University Healthcare Group. Our students gain very critical and very important clinical experience in those groups' various hospitals right across this region. Again, I mention all those hospitals, all of which are very important to us. Galway, Letterkenny, Sligo, Castlebar, Roscommon and Portiuncula, all of them important to our university, all of them part of our network of clinical education. And the true value of this partnership is to the health system across this region, which I know is significantly strengthened by an integrated academic health centres approach, which is now the basis of the emerging groups in our country. As has been said earlier, Galway is also an emerging global hub for the med tech sector, and for that reason the university prioritised biomedical engineering science many years ago. And over the past 2 decades we've invested significantly in that area, creating very significant research facilities, including, for example, the Regenerative Medicine Institute, CURAM, the very large SF5-funded Centre for Research in Medical Devices, and unique in Ireland, and one of only 6 or 7 in Europe, a Centre for Cell Manufacturing, which provides us with the capacity to manufacture, as it were, stem cells for clinical trials in this facility. Essentially, our university researchers advance scientific knowledge and engineering knowledge to address healthcare challenges. In this facility, in this building, that knowledge translates into novel treatments, then carefully applied in a clinical setting and tested in clinical trials. The result of that, we know, will be better outcomes for patients. Let me say a word about philanthropy, which has really been very important to this particular project and to its success. This project is essentially possible because of very strong collaboration, as Maurice already said, and a tremendous spirit of cooperation right across a whole series of different groups, both state and private. A spirit of mehel, if I can use the old Irish expression. And I want to recognise the support of all of our partners, the CLT University Hospital Group, the Health Research Board, the HSE, and most of all, Galway University Foundation. Because, as I said, philanthropy has been central to the realisation of this project. Among the supporters who made this facility possible are the National Breast Cancer Research Institute, represented here by Helen Ryan as chairman, the Bank of Ireland, represented by PJ Kavanagh, the Corb Medical Network, represented by Professor Michael Kern, and most importantly, I want to signal out Ronan and Anne Lambe. I want to acknowledge in a very special way their leadership and their philanthropy, and their support has been central to the realisation of this project. Dr. Ronan Lambe has been a part of this university for over 5 decades. He's a proud graduate of NUI Galway, BSc and a master's degree. He's a former lecturer in the university. He's now a member of the University Foundation Board and a philanthropist. He has seen at first hand, and I would say in a very special and unique way, the continuing development of his alma mater. And we are certainly honoured and grateful to him and his wife Anne, who joined us here today as we open this translational research facility which bears their name. I am sure that it will bear their name with great pride and will make them proud in years to come as new therapies and new treatments emerge from the work here. As I've said, many organisations have given of their energy and of their commitment to see this project to fruition. I want to acknowledge the leadership of the Foundation, the University Foundation. I want to acknowledge Tom Joyce, the CEO, and John McNamara, the chairman, indeed the whole board. I want to recognise also academic and institutional leadership inside the university, Professor Michael Kern, Professor Martin O'Donnell, Professor Tim O'Brien, Dean of our college. All those across the university who contributed to this very complicated and very complex project, which I now delivered. People like Keith Warnock, who unfortunately cannot be here today, John Gibney and his colleagues in the Buildings Office, the team in the HSC and the Sealta Group, the Health Research Board led by Graham Love and his predecessors Enda Connolly and Ruth Barrington, and also the design team and the builders, BAM Construction, who did a fabulous job on this facility. So having thanked those, Taoiseach, maybe I come back to you and say, just remind you that you visited this university last February. At that time you launched a biomedical sciences facility, which I can tell you is thriving, is full. We're looking at expanding it, believe it or not. The measure of the commitment and the measure of the energy going in there, that the building is now full. We may come back looking for some support at some point. But you said at that time, you said that was a place where miracles would happen. I would suggest that the scientific advances made in facilities like that, made in those laboratories, will translate into clinical outcomes which will improve patients' lives. Just now, in the last half an hour, you've met some of those patients. You have seen that they have new hope because of new scientific advances. This facility is about nurturing that hope and, in effect, realising treatments for them which gives them faith in that hope. Working with the HRB and with the Sealta Group, we believe NUI Galway can be part of a much better future for our healthcare system. Garmina Maki, thank you very much. Can I now call on the Taoiseach and the Kenny to say a few words? Taoiseach, over to you.
A bhéir agus gona úsle, gur magad Jim a socht an curahóid sam tachtan seo. Tá mat rééis tacht ó ón chail mór, manisteir chail mór chuna mara, áit se méid buintseach ó siúd ó chósaí Éideachas le ollscoil na Héireann agus go mór le cúna dé ollscoil Gaillimh na Héireann agus mar sin de. It's all been said. This is just a building. What do they do in there? People pass by in this medical complex. I think this is a place where miracles will happen. The reason I say that is that I talk to the people upstairs, both in the engineering end of things, married to the clinical end of things. You can see it in their faces. They're driven. They're on a voyage. They're on an adventure curve here. Who knows what discoveries lie out ahead? Who knows what Nobel person is in the room here who may come across a startling discovery in this very building. And what is important about the building, I like it, the light and all the rest of it. I know that it took 3 or 4 attempts to get it up, but it's a place that's neat, that's compact, where people are going to engage with each other because they know each other. And isn't it out of those kind of miniature cauldrons that comes the next idea? Or why can't we do that? Or have you tried this? Or whatever. And when I spoke to the people, patients who were courageous enough to come in and say, this is what's wrong with me. I'm on a trial for bone cancer for 2 years. I have no more pain. You can see that in their faces because of what people here do and what people elsewhere do. And isn't that what we're all about? That the facility that is put here can ease our passage, whether young or not so young, through the mortal conveyor belt that we're all on. I launched a thing for Mr. Chuck Feeney recently in the Royal Irish Academy, and as you know, he's a philanthropist extraordinaire. But he did say at one stage that it was always good to be able to spread your wealth while you still had a pulse. Ronan, thank you very much for what you do, and the list of sponsors who are here. All of these people have been prepared to contribute to a journey that this marriage between engineering and the clinical end of things come together to produce products or clinical perfection that people will say, I know what they do in there. They do research, they do discovery, they do collaboration to make things better. It's always important for people like me to have it explained in very simple English what actually goes on here. And the example that I had upstairs, Jim, of the belt being designed here after clinical analysis for little babies, where urine's forced back up into the kidney, causing great pain. Mommy doesn't know, the child can't speak, but the analysis from what clinicians find, the engineering capacity to make something that can determine this in a more simple way, less invasive way, that can deal with pain and bring comfort and consolation. That's what they do here. And we're already in a leading position globally with what you do here in the Galway region with all the medical devices that are manufactured that service millions of people all over the world. So to Professor Tim and Professor Michael and Professor Mark and your teams, thank you for what you do and thank you for the collaboration that you show. And obviously, congratulations to NUI Galway, the Health Research Board and the HSE and bringing the HRB clinical research facility here to completion. I often tell the story that I was down in a major facility down in Cork, and the chief executive in front of 2,500 engineers said, well, he's the next Zuckerberg here, the next Tim Cook here, or whoever. So if you are, step forward, and 100 hands went up. And isn't that the great thing for the sponsors here, that someday, maybe this evening, maybe tomorrow, maybe in a year's time or 5 years' time, somebody in this building, walking between engineering and clinicians, will discover something that's going to impact on millions of people around the world. Is there any finer journey that one can be on? And I can see that in the faces of the young researchers that you have here. So we've moved on. Past is past. Galway, Cork, Dublin, 3 brilliant facilities that are going to work together in the interests of our common humanity and what it is that we have to deal with. So this building is about credibility. This building is about research. This building is about following through on the foundations. I have to say that have been identified for many years of what science and technology and innovation can actually do. I met a group in America last week who have $4 billion to spend on research and innovation. They weren't aware of the capacity of what exists in our country with young creative minds who are prepared to follow trails that haven't been followed before. So in this area of engineering and clinical practice, the investments that are being made here have a significant impact, and they will continue to have a significant impact on our economy for very many years to come. And I know that the assessment teams that do these things, it takes quite a while and obviously very complex to put it together. But the cost-benefit analysis of many of the things that have been designed, created, proven and trialled speak for themselves. We've been in the last week alone, Ireland's been designated as one of the top 10 most innovative countries in the world by any global index. And isn't it a wonderful thing that this facility here, the Lambe Institute, in this location, speaks for itself, and its name, I think, will rank among the stars for very many years to come. So we've moved on from kind of the old, health system to a health service, and we need more of that as we move along, and that's why this marriage is so important. Obviously, the service has to be safe. It has to be dynamic. It has to be innovative, but it's got to be available in a way that's going to impact to the benefit for so many people. So I suppose there are few actually who have an opportunity to impact on the lives of so many people. Look at them. Their faces tell the story of relief. It's not that we all want to live longer, it's that you want to live better. And when you meet people of very senior years who've never been ill and who are compos mentis and still coordinated and take their exercise and all the rest of it, isn't it a wonderful thing that they live their lives right through in that way when others unfortunately don't have that opportunity? And that's why this marriage, this wedding here, if you like, between engineering and clinical research is so important. Because out there are millions of people who are waiting, suffering their pain or whatever, and it may well be that the answer is going to come from the Lambe Institute here in Galway. So it's a privilege to be here, to meet you all. Wish you well, Jim, on your long journey of expansion of NUIG. It's now a brilliant campus. We have coordinated and put a cohesion into it. And in that sense, the next 2 or 3 generations of students will pay you tribute. Thanks very much. I'm sorry that Galway lost, and I'm sorry that Mayo lost. And it's,
So I think, Taoiseach, I was interested in your story in Cork, that as a Cork man, of 2,500 people, there was only 100 put their hands up. The other 2,400 must have had problems. But, so in closing, and I'm just apologise for all your time on your feet, but in closing, it's 100 years since Will and Charlie Mayo, the founders of the Mayo Clinic, nothing to do with County Mayo, but that 100 years since they first issued the words, "The needs of the patient must always come first." And that's the aphorism that holds throughout the whole practice there. I'd like to commit that we here on the west of Ireland will strive to live up to that aspiration by delivering an environment in which the best care possible is delivered to patients, and an environment in which the education of the carers of today and tomorrow and the development of novel and enhanced treatment strategies are discovered. It's fitting that we stand here at the confluence of facilities of clinical education, clinical research, and clinical practice. And that was no accident. So I'd like to invite you all to stay on for a reception afterwards, and I'd like to call on the Taoiseach and the President to unveil the plaque. Thank you. Thanks.